I wanted to reach out and tell you about an employee in the ICU that went above and beyond and completely stands out as a Grand Slam employee. We had a terrible tragedy with a car accident where multiple alerts came into the ER with multiple teenagers critically injured. I spent a better part of 5 hours in the trauma bay with our first trauma alert. The patient was very critical, and I was having a hard time getting this patient to the ICU for various clinical reasons. We received another trauma alert after the first two, so as you can imagine, the staff was pulled thin and working very hard. I was having trouble with an A-line, which was not placed correctly, getting the patient stable enough for transport to ICU. I called the ICU from bedside to give a report and reached Megan Elsbury. What a complete joy to speak with. Not only did she take report on the spot, she knew I was having a very difficult time at bedside. She also heard the next trauma alert, and she came down to the ER at bedside in the trauma bay to review the patient with me. She helped me troubleshoot the A-line, reviewed all systems with me, and looked over all details of the patient together. Other ICU team members also came down to help stabilize the patient since the trauma team was on another trauma alert. The gift of life joined us at bedside also. We all talked about the game plan and were able to move this patient to the ICU without any difficulty. This was a total team effort, and the collaboration was so well I cannot put into words how much of a difference it made in providing patient care. I can say in the 6 years I have worked here, I have never been so floored by a patient-centered care, teamwork, and a positive work environment that Megan displayed that night. I felt a sense of relief knowing I had an ICU nurse on my team and helping me stabilize a very critical patient. I hope this can be passed along to the ICU manager so she knows what a great team member she has, which it was. And then Carolyn commented, Megan always goes out of her way to do what's best for the patient. Positivity and professionalism are always how she drives her care, putting patients first and improving lives. She doesn't take no for an answer and seeks other solutions and believes in. Congratulations. Hey Megan, so you are this month's Daisy Award winner. Congratulations.
Thank you.
And obviously everybody up here is so proud of you, and that comes across in spades. Do you remember the story? Do you remember that night?
I do, of course I do.
Can you tell us what you were thinking when you? So it sounds like Andrea called you.
Yes.
The ER nurse.
So initially, I was really excited because I thrive off adrenaline. I love working in our trauma center. I get really excited to get trauma patients, and this kind of turned out to be still a learning experience, but a little more devastating than usual. So we heard the trauma alerts go out. They were teenagers, children. So after receiving report, I saw that Andrea was flustered, and only in the nurse I was receiving a report from, just because they had high acuity patients down there, they were getting bombarded, they were short-staffed, and I felt it was safest and most appropriate to go down and assess the patient with her instead of trying to receive it over the phone while she was still working on them, actively resuscitating.
So you made that decision based on what you could do?
Yeah. So I went down to the ER and helped and reviewed with Andrea, and it was a lot more dire of a situation than what we were expecting. Gift of life was already here, so we started reviewing possibilities for that end as it was starting to become more obvious that the patient wasn't going to be viable in other ways. Yeah.
So what was it that? Because I'm sure there's cases like that.
Mm-hmm.
You know, that's not an unfamiliar situation. What was it that made you go down there versus just sort of waiting?
So the biggest turnaround and difference in this case for me is we are still in the midst of COVID, and we had not had visitors. So it had been probably 6 months since I've had a patient's visitors at bedside, and the patient's parents were here. So not only do you have a parent at bedside who's grieving or panicked, but you also have a parent of a child that's still an unexpected tragic situation, and Andrea was trying to balance them as well. So I kind of felt that I needed to go down there and introduce myself and get them more comfortable, as we do, because the ICU is a scary place to come visit anyone. But that was the most complicated part for me. I had a lot of support from my nurses, my charge nurse, and then in the morning my manager Carolyn went out with me to approach the parents, because I truly didn't know at what point what to do with them. It was a hard balance, and the patient required a lot of attention on their own, so it was a difficult balance to care for the patient but also support the family at bedside as well.
You talked a little bit about that period of time, and obviously it's been a long 8 months for all of us.
Yes.
What was it in the midst of that helped you really stay so focused on what that patient and his or her family needed?
Someone once told me that with those patients, it's like reading a book that you already know the ending to. And sometimes in our line of work, it's hard to put yourself in the patient or their family's perspective. And I feel like constantly reminding myself that this is their emergency, and in that case it was, but some patients don't have that dire of a situation. Just constantly centering myself that this is not my emergency, it's theirs. It is not my tragedy, it's theirs, really helps center my thoughts and compassion and helpfulness towards the family and their patient instead of myself, and that keeps me grounded and centered. Yeah.
Wow, that's amazing. If you could give advice to yourself 3 years ago, or nurses who are just entering the workforce now, in terms of what's helped you, what speaks to that incredible compassion that you have, what would you tell them?
Take every opportunity that you can. The best thing I ever did was wait until someone told me no. When I first started, I put myself in every position I could to learn, and I waited until I was told to get out, basically. So if there was something cool going on in the room, a procedure, I put myself in there almost to the point where I was in the way because I wanted to see it, and I stayed until someone told me that there had to be gone, and that's the only way to learn. I put myself in rooms with not only the physician taking care of myself, but another physician if that was an interesting case. I like to sit with multiple members of the team to see how they interact with family and patients to learn better ways to communicate. I feel like I have a poor communication skills, and I feel like I can only strengthen them by seeing how other people communicate without being so repetitive. But I would just say keep seeking what you want. As a new grad that went straight to the ICU, there's a lot of people that want to tell you no. They want you to start on other units. They want you to, start, I don't even want to say at the bottom because that's inappropriate, but start somewhere else. They don't want you to start in a high acuity area, but I knew what I wanted, and you have to just keep fighting because someone's going to be on your team eventually. You have to be on your own team for a while, but someone's going to fight for you in the end.
Well, there's a lot of people on your team.
Yeah, and you'll build an awesome team and find your mentors.
It's important through your career, right?
Yeah.
I mean, that's not even, I think your advice really holds true for all of us, no matter where we are, beginning, middle, end. There's always things to learn, and there's always ways to do things better. And I think, just in, what little I do know about you and your practice, obviously you are absolutely that for, I'm sure, 1 million people already.
Oh, thank you.
You are, what we hope when any of us are put in that position like you described, where it's the worst day of your life and you're so dependent on the people who are there to take care of you. And I can only wish that everyone who's ever in that position gets a nurse like you.
Thank you.
So congratulations.
Yay!